Medical Assistant Exam Last-Minute Review. Question 1. After reviewing the situation in a certification exam scenario, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, oxygen saturation and pain score. Option B, blood pressure and temperature. Option C, height and weight. Option D, pulse and respirations. The correct answer is option C, height and weight. Body mass index is calculated from height and weight. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Question 2. After reviewing the situation in a certification exam scenario, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, skip the pulse and record not available. Option B, use the patient's previous pulse from the chart. Option C, count for 10 seconds and multiply by 6. Option D, count the pulse for a full 60 seconds. The correct answer is option D, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Short counts are less reliable when the rhythm is irregular. Question 3. To protect safety in a cardiology practice, a student asks which blood component helps with clotting. Which answer is correct? Option A, plasma glucose. Option B, neurons. Option C, alveoli. Option D, platelets. The correct answer is option D, platelets. Platelets help form clots and support hemostasis. Glucose is a blood sugar and does not form clots. Neurons transmit nerve signals and are not blood clotting cells. Alveoli are lung structures involved in gas exchange. Question 4. When a patient encounter unfolds in a specialty referral visit, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, SOAP. Option B, NPO. Option C, RACE. Option D, PRN. The correct answer is option C, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. SOAP is a documentation format and does not guide fire response. NPO means nothing by mouth and is unrelated to fire safety. PRN means is needed and does not guide emergency fire response. Question 5. In an electronic health record review, a standard electrocardiogram is ordered for a patient with lotion on the chest. Which action improves electrode adhesion? Option A, clean and dry the skin before applying electrodes. Option B, use tape only and skip electrodes. Option C, apply electrodes directly over lotion. Option D, move all chest leads to the abdomen. The correct answer is option A, clean and dry the skin before applying electrodes. Oil or lotion can prevent proper electrode contact and should be removed according to protocol. Tape cannot record cardiac electrical activity. Poor adhesion can cause artifact or lead loss. Incorrect lead placement changes the tracing and may impair interpretation. Question 6. For a patient encounter in a cardiology practice, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A, begin CPR and use the automated external defibrillator as directed. Option B, give oral medication before checking responsiveness. Option C, use the defibrillator on a conscious patient asking questions. Option D, wait for the provider before starting any response. The correct answer is option A, begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. Oral medication is unsafe when cardiac arrest is suspected. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Question 7. Following office protocol in a specialty referral visit, a patient questions a medication that looks different from the usual dose. Which response is safest? Option A, give the medication quickly before the patient refuses. Option B, pause administration and verify the order and medication. Option C, tell the patient that questions are not allowed. Option D, document that the patient was difficult and continue. The correct answer is option B, pause administration and verify the order and medication. A patient concern can identify a potential medication error, so verification is required before proceeding. Rushing increases risk and ignores a safety concern. Patients should be encouraged to participate in safety. Labeling the patient does not resolve the possible medication issue. Question 8. To protect safety in a telephone triage workflow, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Tell the patient dizziness is impossible. Option B. Ask the patient to walk faster. Option C. Leave the patient standing while searching for forms. Option D. Assist the patient to sit or lie down safely. The correct answer is option D. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. An unsteady patient should not be left unsupported. Question 9. An office review in a walk-in clinic shows that the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A. Abnormal softening. Option B. Visual examination. Option C. Surgical removal. Option D. Inflammation. The correct answer is option C. Surgical removal. Ectomy means surgical removal of a structure. Abnormal softening is indicated by malacia. Visual examination is often indicated by scopy. Inflammation is indicated by itis. Question 10. Before the visit continues in a patient education session, a patient is placed lying face down for a back examination. Which position is being used? Option A. Fowler. Option B. Prone. Option C. Supine. Option D. Lithotomy. The correct answer is option B. Prone. Prone means lying on the abdomen with the face downward. Fowler is a seated or semi-seated position. Supine means lying on the back. Lithotomy involves legs in stirrups for certain pelvic procedures. Question 11. As part of exam preparation in a medication administration visit, the term hypertension appears in the problem list. Which meaning is correct? Option A. Slow breathing. Option B. High blood pressure. Option C. Joint inflammation. Option D. Low blood glucose. The correct answer is option B. High blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Slow breathing is bradypnea. Joint inflammation is arthritis. Low blood glucose is hypoglycemia. Question 12. During an administrative check-in area, the term otitis media is listed in the assessment. Which body area is involved? Option A. Middle ear. Option B. Liver. Option C. Kidney. Option D. Stomach. The correct answer is option A. Middle ear. Otitis media refers to inflammation or infection involving the middle ear. Liver inflammation is hepatitis. Kidney inflammation is related to nephritis or pyelonephritis. Stomach inflammation is gastritis. Question 13. When a patient encounter unfolds in an internal medicine office, a patient is suspected of having tuberculosis. Which type of precautions is most appropriate? Option A. Contact precautions only. Option B. Reverse isolation for staff protection only. Option C. Droplet precautions only. Option D. Airborne precautions. The correct answer is option D. Airborne precautions. Tuberculosis can spread through airborne particles and requires airborne precautions with appropriate respiratory protection. Contact precautions focus on direct or indirect touch transmission and are not enough for tuberculosis. Reverse isolation protects immunocompromised patients rather than controlling tuberculosis spread. Droplet precautions do not address smaller airborne particles that can remain suspended. Question 14. As part of exam preparation in a clinical skills review, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A. Switch to a rectal temperature without asking. Option B. Wait according to office protocol before measuring the oral temperature. Option C. Take the temperature immediately because oral readings are unaffected. Option D. Record the temperature as normal without measuring it. The correct answer is option B. Wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Changing to an invasive route requires proper indication and protocol. Recent liquids can affect oral temperature results. Vital signs must be measured rather than assumed. Question 15. While working in a phlebotomy station, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Apply lotion instead of cleaning hands. Option B. Place the gloves in a regular drawer. Option C. Perform hand hygiene. Option D. Use the same gloves to clean the next room. The correct answer is option C. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Lotion does not replace hand hygiene. Used gloves are contaminated waste and should be discarded properly. Gloves are task-specific and should not be reused between patients or areas. Question 16. A medical assistant is working in a family practice clinic when a patient is placed lying flat on the back for an abdominal exam. Which position is being used? Option A. Prone. Option B. Sims. Option C. Supine. Option D. Fowler. The correct answer is option C. Supine. Supine means lying on the back facing upward. Prone means lying face down. Sims position is side lying with one knee flexed. Fowler position is seated or semi-seated. Question 17. When a patient encounter unfolds in a family practice clinic, a patient with known latex allergy is scheduled for a procedure. Which preparation is best? Option A. Use latex-free supplies and clearly communicate the allergy. Option B. Tell the patient to bring personal gloves only. Option C. Use powdered latex gloves because they are easier to put on. Option D. Ignore the allergy if the procedure is short. The correct answer is option A. Use latex-free supplies and clearly communicate the allergy. Avoiding latex exposure prevents allergic reactions and keeps the team aware of the risk. The clinic remains responsible for preparing a safe care environment. Latex gloves can trigger a reaction in a latex allergic patient. Even brief latex exposure can cause a serious reaction. Question 18. At the start of care in a diagnostic testing area, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Using sterile forceps for sterile supplies. Option B. Keeping sterile items above waist level. Option C. Reaching across the sterile field with an unsterile sleeve. Option D. Opening the wrapper away from the body first. The correct answer is option C. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile forceps can help maintain asepsis when used correctly. Sterile items are generally kept in view and above waist level. Opening the far flap first is a common way to avoid reaching over the field. Question 19. Given the workflow in a treatment room, a medication is labeled for otic use. Where should it be administered? Option A. Nose. Option B. Mouth. Option C. Ear. Option D. Eye. The correct answer is option C. Ear. Otic medications are intended for the ear. Nasal medications are administered through the nose. Oral medications are taken by mouth. Eye medications are ophthalmic, not otic. Question 20. A medical assistant is working in a certification exam scenario when a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Make an addendum according to office policy. Option B. Ask a coworker to change it under their login. Option C. Ignore the error even if it affects care. Option D. Delete the original note completely. The correct answer is option A. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Clinically important errors should be corrected through proper procedures. Deleting a signed record can destroy the audit trail. Question 21. A medical assistant is working in a patient intake station when a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A. Tell the patient the reading is probably wrong. Option B. Promise that the provider will not be concerned. Option C. Ignore the anxiety to avoid making it worse. Option D. Acknowledge the concern and explain the procedure in simple terms. The correct answer is option D. Acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Dismissing the result can reduce confidence and may be clinically misleading. Promising an outcome goes beyond the assistant role and may be inaccurate. Ignoring patient concerns can increase anxiety and weaken communication. Question 22. At the start of care in an outpatient laboratory, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A. Deny the request because there is no job-related need to know. Option B. Open the chart if the coworker promises not to tell anyone. Option C. Share the chart because staff work in the same clinic. Option D. Print the chart and remove the patient's name only. The correct answer is option A. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. Question 23. After reviewing the situation in an internal medicine office, a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A. Lavender EDTA tube for serum. Option B. A red or gold serum tube. Option C. Light blue citrate tube for serum. Option D. Gray fluoride tube for all serum tests. The correct answer is option B. Red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Gray tubes are not the standard serum tube for routine chemistry panels. Question 24. In an urgent care office, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Gently adjust the needle position while maintaining safety. Option B. Label the empty tube as collected. Option C. Probe aggressively until blood returns. Option D. Remove the tourniquet and continue filling all tubes. The correct answer is option A. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. A tube without the required specimen must not be labeled as completed. Excessive probing can injure tissue and increase patient discomfort. Without blood flow, the collection cannot continue effectively. Question 25. To protect safety in a certification exam scenario, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A. Autoclave tape. Option B. Hemostat. Option C. Snellen chart. Option D. Tourniquet. The correct answer is option C. Snellen chart. A Snellen chart is used to screen distance visual acuity. Autoclave tape indicates exposure to sterilization conditions. A hemostat clamps tissue or small objects during procedures. A tourniquet helps locate veins for blood collection. Question 26. While working in a walk-in clinic, a patient asks the assistant whether to stop taking a prescribed medication. Which response is appropriate? Option A. Refer the question to the provider. Option B. Suggest using a friend's medication. Option C. Recommend doubling the dose instead. Option D. Tell the patient to stop immediately. The correct answer is option A. Refer the question to the provider. Medication changes require provider guidance because stopping therapy can be unsafe. Sharing medication is unsafe and inappropriate. Changing a dose without provider order is unsafe and outside scope. Directing medication discontinuation is outside the assistant role. Question 27. Following office protocol in a medication administration visit, the endocrine system is being reviewed. Which gland produces thyroid hormone? Option A. Gallbladder. Option B. Urinary bladder. Option C. Appendix. Option D. Thyroid gland. The correct answer is option D. Thyroid gland. The thyroid gland produces hormones that help regulate metabolism. The gallbladder stores bile and is not an endocrine gland producing thyroid hormone. The urinary bladder stores urine and does not produce thyroid hormone. The appendix does not produce thyroid hormone. Question 28. During a treatment room, a provider orders a medication using an abbreviation on the unsafe abbreviation list. Which action should the medical assistant take? Option A. Ignore the medication order completely without communication. Option B. Clarify the order before proceeding. Option C. Interpret the abbreviation however it seems most likely. Option D. Ask another patient what the abbreviation means. The correct answer is option B. Clarify the order before proceeding. Unsafe or unclear medication orders must be clarified to prevent misinterpretation. The order should be clarified rather than silently ignored. Guessing can lead to serious medication errors. Patients are not appropriate sources for interpreting orders. Question 29. When a patient encounter unfolds in a quality control review, the provider mentions the largest artery in the body. Which vessel is being described? Option A. Aorta. Option B. Carotid vein. Option C. Vena cava. Option D. Pulmonary vein. The correct answer is option A. Aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Carotid structures are in the neck, but the carotid artery is not the largest artery. The vena cava is a large vein returning blood to the heart. Pulmonary veins return blood from the lungs to the heart. Question 30. After reviewing the situation in an exam room, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Lock the wheelchair and use proper body mechanics with assistance as needed. Option B. Pull the patient by the arms quickly. Option C. Leave the wheelchair unlocked for easier movement. Option D. Ask the patient to jump to the table. The correct answer is option A. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Pulling can injure the patient and the assistant. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Question 31. Following office protocol in a specialty referral visit, a venipuncture site is cleansed with alcohol before collection. Which action helps prevent hemolysis and discomfort? Option A. Allow the alcohol to dry completely. Option B. Draw blood while alcohol is still wet. Option C. Blow on the site to speed drying. Option D. Touch the vein again with an ungloved finger. The correct answer is option A. Allow the alcohol to dry completely. Letting alcohol dry reduces stinging and helps avoid contamination or hemolysis from wet alcohol. Wet alcohol can sting and may affect specimen quality. Blowing can contaminate the cleansed site. Palpating after cleaning can contaminate the site unless proper technique is used. Question 32. To protect safety in an infection control audit, a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The side of the middle or ring finger pad. Option B. The tip of the index finger. Option C. The center of the thumb pad. Option D. The little finger near the bone. The correct answer is option A. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The index finger is commonly used for touch and may be more sensitive or calloused. The thumb is often calloused and has a pulse, making it less preferred. The little finger has less tissue over bone and is usually avoided. Question 33. After reviewing the situation in an administrative check-in area, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A. Provide standardized guidance for office tasks. Option B. Replace all state laws. Option C. Eliminate the need for training. Option D. Guarantee every claim is paid. The correct answer is option A. Provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Office policy cannot override applicable law. Policies support but do not replace staff training. Policies do not guarantee pay or reimbursement. Question 34. At the start of care in an exam room, a staff member shares an electronic health record password to save time. Which risk is created? Option A. Better sterilization monitoring. Option B. Automatic insurance approval. Option C. Loss of accountability for chart access. Option D. Improved privacy protection. The correct answer is option C. Loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Login credentials do not sterilize instruments. Passwords do not control payer authorization. Password sharing weakens privacy and security. Question 35. At the start of care in a community health clinic, the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A. Give instructions as quickly as possible. Option B. Use medical jargon to sound professional. Option C. Ask the patient to explain the instructions back in their own words. Option D. Ask only whether the patient has any questions. The correct answer is option C. Ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Rushing can reduce comprehension. Jargon can confuse patients and reduce understanding. Patients may say no even when they misunderstand instructions. Question 36. After reviewing the situation in a patient education session, a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Use clear language and review the key points with the patient. Option B. Provide instructions in the wrong language. Option C. Use only complex medical terminology. Option D. Tell the patient to search online without guidance. The correct answer is option A. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Language mismatch can prevent safe understanding. Complex terms can reduce comprehension. Unguided online searching may provide inaccurate or confusing information. Question 37. At the start of care in an internal medicine office, a patient has chest hair that prevents electrodes from adhering. Which action is most appropriate? Option A. Ignore loose electrodes if the tracing prints. Option B. Prepare the skin according to protocol to improve electrode contact. Option C. Wet the electrodes with tap water only. Option D. Place electrodes over clothing. The correct answer is option B. Prepare the skin according to protocol to improve electrode contact. Good skin preparation helps electrodes adhere and improves tracing quality. Loose electrodes can create artifact and poor quality results. Unapproved moisture does not replace proper skin preparation. Electrodes must contact skin to record electrical activity. Question 38. When a patient encounter unfolds in a women's health clinic, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Breach of confidentiality. Option B. Routine scheduling. Option C. Appropriate marketing. Option D. Quality control testing. The correct answer is option A. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Scheduling does not involve posting private health information publicly. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Quality control relates to test system accuracy, not social media disclosure. Question 39. Following office protocol in a primary care office, a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A. Have the patient walk quickly before the measurement. Option B. Record the first seated blood pressure as orthostatic. Option C. Measure only oxygen saturation while the patient is seated. Option D. Measure blood pressure and pulse in different positions according to protocol. The correct answer is option D. Measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. Exertion can distort the readings and increase fall risk. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Question 40. While working in an infection control audit, a patient has an advance directive in the chart. Which statement is most accurate? Option A. It communicates the patient's wishes about future medical care. Option B. It allows the assistant to ignore provider orders. Option C. It is used only to schedule appointments. Option D. It replaces all insurance forms. The correct answer is option A. It communicates the patient's wishes about future medical care. An advance directive helps guide care decisions if the patient cannot speak for themselves. Care decisions still follow legal, clinical, and facility processes. Scheduling is unrelated to the purpose of an advance directive. Advance directives do not replace billing or insurance documents. Question 41. When a patient encounter unfolds in a phlebotomy station, the term bradycardia appears in the chart. Which meaning should the medical assistant recognize? Option A. Inflammation of the liver. Option B, fast breathing. Option C, high blood sugar. Option D, slow heart rate. The correct answer is option D, slow heart rate. The prefix brady means slow, and cardia refers to the heart. Inflammation of the liver is hepatitis. Fast breathing is tachypnea rather than bradycardia. High blood sugar is hyperglycemia. Question 42. For a patient encounter in a diagnostic testing area, the term cardiology appears in a referral. Which specialty is involved? Option A, digestive disorders. Option B, skin disorders. Option C, kidney disorders. Option D, heart and cardiovascular system. The correct answer is option D, heart and cardiovascular system. Cardiology focuses on the heart and cardiovascular system. Gastroenterology focuses on the digestive system. Dermatology focuses on the skin. Nephrology focuses on the kidneys. Question 43. While working in an urgent care office, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, correct limb lead placement. Option B, a normal calibration mark only. Option C, poor electrode contact or patient movement. Option D, a properly grounded machine with still patient. The correct answer is option C, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Correct placement should reduce rather than create artifact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Question 44. A medical assistant is working in a clinical skills review when an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, respondeat superior. Option B, abandonment. Option C, patient autonomy. Option D, beneficence. The correct answer is option C, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Respondeat superior concerns employer responsibility for employee actions. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Question 45. An office review in an urgent care office shows that a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, warm the finger or choose a better perfused site. Option B, increase oxygen without reporting the finding. Option C, place the probe over wet nail polish. Option D, ignore the waveform and record the lowest value. The correct answer is option A, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. An unstable signal should be corrected before documenting the value. Question 46. During a quality control review, an insurance plan requires approval before a specialist visit. Which process is being described? Option A, auscultation. Option B, venipuncture. Option C, prior authorization or referral process. Option D, autoclaving. The correct answer is option C, prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Auscultation is listening to body sounds and does not approve visits. Venipuncture is blood collection and does not authorize insurance coverage. Autoclaving sterilizes instruments and is unrelated to payer approval. Question 47. In a same-day appointment, an order reads amoxicillin 500 mg by mouth. Which abbreviation matches the route? Option A, IM. Option B, PA. Option C, subcut. Option D, A4. The correct answer is option B, PA. PA means by mouth and is used for oral administration. IM means intramuscular and refers to injection into muscle. Subcut means subcutaneous and refers to injection into tissue under the skin. For means intravenous and refers to administration into a vein. Question 48. An office review in a medication administration visit shows that the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A, pancreas. Option B, bladder. Option C, spleen. Option D, gallbladder. The correct answer is option D, gallbladder. The gallbladder stores and concentrates bile made by the liver. The pancreas produces digestive enzymes and hormones but does not store bile. The urinary bladder stores urine, not bile. The spleen is involved in immune and blood cell functions. Question 49. Before the visit continues in a walk-in clinic, the abbreviation PRN appears on a medication list. Which meaning should be recognized? Option A, immediately. Option B, as needed. Option C, by mouth. Option D, every morning. The correct answer is option B, as needed. PRN means the medication is taken as needed according to the order. Immediately is stat in common medical usage. By mouth is PA. Every morning is commonly abbreviated differently and is not PRN. Question 50. The care team in a preventive care visit asks for guidance because a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, place the form in the chart without reviewing it. Option B, remove allergies that the patient says happened many years ago. Option C, ask the patient to remember only prescription allergies. Option D, verify the allergy information and enter it clearly in the medical record. The correct answer is option D, verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Important safety information can be missed if the history is not reviewed. Past reactions may still be clinically important and should not be deleted without provider direction. Allergies to over-the-counter drugs, foods, or latex may also affect care. Question 51. Before the visit continues in a medication administration visit, the assistant reviews the path of blood leaving the right ventricle. Which vessel receives it? Option A, pulmonary artery. Option B, aorta. Option C, superior vena cava. Option D, pulmonary vein. The correct answer is option A, pulmonary artery. The pulmonary artery carries deoxygenated blood from the right ventricle to the lungs. The aorta carries oxygenated blood from the left ventricle to the body. The superior vena cava returns venous blood to the right atrium. Pulmonary veins return oxygenated blood from the lungs to the left atrium. Question 52. At the start of care in a telephone triage workflow, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, collect urine only when symptoms occur. Option B, keep only the first void and discard the rest. Option C, leave the container unrefrigerated unless it smells unusual. Option D, discard the first void and collect all urine for the next 24 hours. The correct answer is option D, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Timed urine testing requires all urine during the collection period. A single first void is not a 24-hour collection. Storage requirements should follow the test protocol and preservative instructions. Question 53. After reviewing the situation in a pediatric clinic, a centrifuge is used in the laboratory. Which safety practice is important? Option A, open the lid while it is spinning. Option B, place only one tube at any weight in the rotor. Option C, balance tubes before starting the centrifuge. Option D, stop the rotor with a hand. The correct answer is option C, balance tubes before starting the centrifuge. Balancing tubes helps prevent vibration, breakage, and equipment damage. Opening a spinning centrifuge is unsafe. Unbalanced loads can damage the machine or specimens. Stopping a rotor manually is dangerous. Question 54. In a patient education session, a pregnancy test performed in the office is classified as wave testing. Which requirement still applies? Option A, use expired kits if the package is unopened. Option B, follow manufacturer instructions and quality control policy. Option C, skip controls because waived means unregulated. Option D, report results before the test develops. The correct answer is option B, follow manufacturer instructions and quality control policy. Wave tests are simple, but they still require correct procedure, controls, and documentation. Expired test kits may give unreliable results. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Question 55. While working in an administrative check-in area, the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, caller identity, contact information, reason for call, and urgency. Option B, only the caller's first name. Option C, the assistant's guess about the diagnosis. Option D, a promise that medication will be prescribed. The correct answer is option A, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. A first name alone may not identify the patient or issue. Diagnosis should not be guessed in a phone message. Medication decisions belong to the provider. Question 56. During a certification exam scenario, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, give a diagnosis over the phone. Option B, follow emergency triage protocol immediately. Option C, tell the patient to send an email later. Option D, schedule the patient for next month. The correct answer is option B, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Question 57. Following office protocol in a diagnostic testing area, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the reading may be inaccurate. Option B, the patient will automatically faint. Option C, the pulse oximeter will stop working. Option D, the oral temperature will decrease. The correct answer is option A, the reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Blood pressure cuff alignment does not control the pulse oximeter. Cuff placement does not change oral temperature. Question 58. As part of exam preparation in an exam room, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, recheck using proper technique and report the finding according to protocol. Option B, erase the value because it may worry the patient. Option C, send the patient home to rest without notifying anyone. Option D, tell the patient that hypertension has been diagnosed. The correct answer is option A, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Question 59. A medical assistant is working in an exam room when a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A, record patient results without documenting controls. Option B, change the patient's diagnosis to match the meter. Option C, use the meter because patient samples are different. Option D, resolve the quality control problem according to protocol. The correct answer is option D, resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Failed controls must be addressed before reporting patient values. Question 60. An office review in an exam room shows that a chemistry panel requiring plasma is ordered and the facility uses heparin tubes. Which tube color is commonly associated? Option A, light blue tube. Option B, gray tube. Option C, lavender tube. Option D, green tube. The correct answer is option D, green tube. Green tubes commonly contain heparin and are used for certain plasma chemistry tests. Light blue citrate is used for coagulation testing. Gray tubes are often used for glucose-related testing depending on protocol. Lavender EDTA is typically used for hematology testing. Question 61. At the start of care in a diagnostic testing area, the assistant prepares the room for a minor sterile procedure. Which action supports patient dignity? Option A, leave the patient uncovered until the provider arrives. Option B, provide appropriate draping and expose only the area being examined. Option C, discuss the patient's body in the hallway. Option D. Skip explanations because the patient signed in. The correct answer is option B. Provide appropriate draping and expose only the area being examined. Draping preserves privacy and warmth while allowing the provider access to the needed area. Unnecessary exposure reduces dignity and comfort. Public discussion can violate privacy and professionalism. Patients still need respectful communication during preparation. Question 62. The care team in a walk-in clinic asks for guidance because the provider asks for an instrument to examine the ear canal. Which instrument should be prepared? Option A. Spirometer. Option B. Otoscope. Option C. Ophthalmoscope. Option D. Speculum for pelvic exam. The correct answer is option B. Otoscope. An otoscope is used to inspect the ear canal and tympanic membrane. A spirometer evaluates lung function rather than the ear. An ophthalmoscope is used to examine internal eye structures. A vaginal speculum is not used to inspect the ear canal. Question 63. For a patient encounter in a diagnostic testing area, the assistant is comparing two needle gauges. Which statement is accurate? Option A. All injections use the same gauge. Option B. Gauge has no relation to needle size. Option C. A larger gauge number always means a longer needle. Option D. A smaller gauge number indicates a larger needle diameter. The correct answer is option D. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Needle gauge varies by medication, route, and patient factors. Gauge specifically describes needle diameter. Gauge describes diameter, not length. Question 64. For a patient encounter in a community health clinic, the nervous system is being reviewed. Which structure carries impulses away from the cell body of a neuron? Option A. Alveolus. Option B. Platelet. Option C. Axon. Option D. Ureter. The correct answer is option C. Axon. An axon carries nerve impulses away from the neuron cell body. An alveolus is a lung air sac. A platelet is a blood component involved in clotting. A ureter carries urine from kidney to bladder. Question 65. Given the workflow in a cardiology practice, a patient requests an appointment reminder by text message. Which consideration is important? Option A. Post the reminder on social media. Option B. Ignore all reminder preferences. Option C. Text any diagnosis to any phone number in the chart. Option D. Follow office policy and patient communication preferences. The correct answer is option D. Follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Public posting would expose private information. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Question 66. As part of exam preparation in a certification exam scenario, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right color of vial and right storage shelf. Option B. Right insurance, right copay, right appointment, and right room. Option C. Right diagnosis only. Option D. Right patient, right medication, right dose, right route, right time, and right documentation. The correct answer is option D. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Vial appearance and shelf location are not sufficient medication rights. Administrative details do not replace medication safety checks. Diagnosis alone is not enough to confirm safe administration. Question 67. In a medication administration visit, a urine culture is ordered for a patient who can void independently. Which collection method is most appropriate? Option A. First drops of urine into an unclean container. Option B. Clean catch midstream specimen. Option C. Specimen collected from the toilet bowl. Option D. A random sample from an old urinal. The correct answer is option B. Clean catch midstream specimen. A clean catch midstream specimen helps reduce contamination from skin or genital flora. Initial urine can carry contaminants and an unclean container is inappropriate. Toilet water contaminates the specimen. Old specimens may be contaminated and may not reflect current results. Question 68. In a walk-in clinic, A patient asks about wound care instructions after a minor procedure. Which response is best? Option A. Review the provider-approved instructions and confirm understanding. Option B. Avoid documenting that instructions were given. Option C. Tell the patient not to call if symptoms worsen. Option D. Create new instructions that contradict the provider. The correct answer is option A. Review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Patient education should be documented according to policy. Patients should know when and how to seek help for concerning symptoms. Instructions should match the provider's plan and office protocol. Question 69. When a patient encounter unfolds in a clinical skills review, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A. Place the paper speed at 0. Option B. Remove all electrodes during the recording. Option C. Help the patient relax and support the limbs. Option D. Ask the patient to tense all muscles. The correct answer is option C. Help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Paper movement is needed to record the waveform. Electrodes are required to capture the tracing. Tensing muscles increases electrical artifact. Question 70. A medical assistant is working in a procedure setup when a provider orders spirometry in the office. Which patient action is required? Option A. Remove the mouthpiece before starting. Option B. Follow instructions for a strong, complete breathing maneuver. Option C. Talk continuously during the maneuver. Option D. Hold both nostrils and refuse to exhale. The correct answer is option B. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The mouthpiece is needed to measure airflow. Talking interferes with airflow measurement. The test depends on controlled breathing through the device. Question 71. At the start of care in an urgent care office, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Apply droplet precautions and offer a mask according to protocol. Option B. Place the patient beside an immunocompromised patient. Option C. Use only sterile gloves without a mask. Option D. Skip precautions if the patient is already taking medication. The correct answer is option A. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Treatment does not remove the need for appropriate precautions. Question 72. To protect safety in a diagnostic testing area, the abbreviation NPO appears before a procedure. Which instruction does it represent? Option A. Nasal passage open. Option B. New patient only. Option C. Normal pulse output. Option D. Nothing by mouth. The correct answer is option D. Nothing by mouth. NPO means the patient should take nothing by mouth for the specified period. NPO is not a nasal assessment abbreviation. New patient only is not the meaning of NPO. NPO does not describe pulse measurement. Question 73. The care team in a preventive care visit asks for guidance because the provider discusses the function of white blood cells. Which role is most accurate? Option A. Help defend against infection. Option B. Produce insulin in the pancreas. Option C. Store bile for digestion. Option D. Carry oxygen as their primary job. The correct answer is option A. Help defend against infection. White blood cells are immune cells that help protect the body from infection. Insulin production occurs in pancreatic beta cells, not white blood cells. Bile storage is a gallbladder function. Oxygen transport is mainly the role of red blood cells. Question 74. While working in an infection control audit, the provider discusses gas exchange in the lungs. Which structure is primarily responsible? Option A. Tendons. Option B. Villi. Option C. Ureters. Option D. Alveoli. The correct answer is option D. Alveoli. Alveoli are tiny air sacs where oxygen and carbon dioxide are exchanged. Tendons connect muscle to bone. Villi increase absorption in the small intestine. Ureters carry urine from the kidneys to the bladder. Question 75. At the start of care in a same-day appointment, a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A. Another patient's insurance card. Option B. The assistant's diagnosis before the visit. Option C. Demographics, contact information, insurance information, and reason for visit. Option D. Only the patient's favorite pharmacy color. The correct answer is option C. Demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. Insurance information must belong to the patient being registered. The assistant should not diagnose during scheduling. That information does not complete registration. Question 76. After reviewing the situation in an urgent care office, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Packaging instruments makes cleaning unnecessary. Option B. Disinfection always destroys every spore. Option C. Organic material can interfere with sterilization. Option D. Sterilization is the same as hand washing. The correct answer is option C. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Packaging dirty instruments traps contamination rather than preparing them safely. Disinfection reduces many organisms but does not reliably destroy all spores. Hand washing reduces microbes on skin but is not instrument sterilization. Question 77. An office review in a community health clinic shows that a patient asks which body system includes the skin. Which system should be identified? Option A. Integumentary system. Option B. Respiratory system. Option C. Urinary system. Option D. Endocrine system. The correct answer is option A. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. The endocrine system is made of hormone-producing glands. Question 78. Given the workflow in a cardiology practice, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A. Patient seems dramatic about ear pain. Option B. Right ear normal after exam. Option C. Ear infection diagnosed today. Option D. Patient reports sharp right ear pain for 2 days. The correct answer is option D. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint. A diagnosis should not be documented by the assistant unless the provider has made it. Question 79. An office review in a busy front office shows that a patient wants information released to a spouse. Which documentation is usually needed? Option A. A verbal request from the spouse only. Option B. A valid authorization or permission according to office policy. Option C. A note written by the assistant after the fact. Option D. No documentation because spouses always have full access. The correct answer is option B. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. The spouse's request alone may not authorize release. Authorization should come from the patient or legal authority. Relationship alone does not automatically grant full access to records. Question 80. Following office protocol in a specialty referral visit, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the room number. Option B. Only the patient's favorite color. Option C. Procedure code and diagnosis or reason for the service. Option D. Only the assistant's initials with no service information. The correct answer is option C. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Room numbers do not describe the service or diagnosis. Personal preferences do not support claim coding. Initials alone do not provide billing codes or medical necessity. Question 81. Given the workflow in a busy front office, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. The patient should skip follow-up if pain increases. Option B, crutches should be used only on wet floors. Option C, body weight should rest mainly on the armpits. Option D, crutches should fit properly and not press into the axilla. The correct answer is option D. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Worsening symptoms should be reported according to instructions. Crutches are mobility aids and wet floors increase fall risk. Weight should be supported through the hands, not the axilla. Question 82. To protect safety in an administrative check-in area, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the left sternal border. Option B, fourth intercostal space at the right sternal border. Option C, left arm below the clavicle. Option D, fifth intercostal space at the left midclavicular line. The correct answer is option B, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V2. The left arm electrode is a limb lead site, not V1. That location corresponds to V4 in standard placement. Question 83. When a patient encounter unfolds in an urgent care office, a payer sends money with a remittance advice. What does the remittance advice explain? Option A. Which vaccine lot is expired? Option B. Where to place EKG chest leads. Option C. How to sterilize forceps. Option D. How the claim was processed and paid or denied. The correct answer is option D. How the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Vaccine inventory is not the purpose of remittance advice. Electrocardiogram placement is unrelated to insurance remittance. Sterilization instructions are not part of remittance advice. Question 84. As part of exam preparation in an administrative check-in area, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A, kidney. Option B, appendix. Option C, spleen. Option D, gallbladder. The correct answer is option A, kidney. The kidneys filter blood, regulate fluid balance, and form urine. The appendix is associated with lymphoid tissue in the digestive tract. The spleen filters blood cells and supports immune function but does not form urine. The gallbladder stores bile and does not form urine. Question 85. For a patient encounter in an internal medicine office, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, record height only because weight changes often. Option B, use the parent's estimate if the scale is nearby. Option C, record the measurements using the unit required by the office protocol. Option D, round weight to the nearest 10 pounds. The correct answer is option C, record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Both height and weight may be needed for clinical assessment. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Question 86. Before the visit continues in a procedure setup, a claim requires the code that explains why a service was performed. Which code set is used? Option A, place of service only. Option B, NDC only. Option C, ICD-10-CM. Option D, CPT. The correct answer is option C, ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. Place of service identifies setting, not the medical reason for care. National drug codes identify medications and do not describe diagnoses. CPT codes report procedures and services rather than diagnoses. Question 87. As part of exam preparation in a family practice clinic, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A, cover the mouth while speaking. Option B, face the patient and speak clearly at a moderate pace. Option C, assume the patient cannot participate. Option D, shout from another room. The correct answer is option B, face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Covering the mouth removes visual cues. Hearing difficulty does not mean the patient cannot understand or decide. Shouting from a distance reduces clarity and privacy. Question 88. Given the workflow in a procedure setup, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The pulse oximetry reading will be inaccurate. Option B. The blood pressure may read falsely high. Option C. The temperature will be elevated. Option D. The blood pressure may read falsely low. The correct answer is option B. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size does not directly determine oxygen saturation accuracy. Cuff size has no direct effect on body temperature. A cuff that is too large is more likely to produce a falsely low reading. Question 89. Given the workflow in a telephone triage workflow, a blood specimen must be mixed with additive after collection. Which technique is appropriate? Option A. Open the tube and stir with a swab. Option B. Gently invert the tube the required number of times. Option C. Leave the tube unmixed until pickup. Option D. Shake the tube forcefully. The correct answer is option B. Gently invert the tube the required number of times. Gentle inversion mixes blood with additive without causing unnecessary cell damage. Opening the tube can contaminate the specimen and expose staph. Failure to mix may cause clotting or poor specimen quality. Forceful shaking can cause hemolysis and inaccurate results. Question 90. After reviewing the situation in a certification exam scenario, a used needle must be discarded after an injection. Which practice is safest? Option A. Recap the needle with both hands. Option B. Carry the needle to the front desk for disposal. Option C. Place the needle in regular trash. Option D. Activate the safety device and place the needle in a sharps container. The correct answer is option D. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Two-handed recapping increases needle stick risk. Transporting exposed sharps through the office increases risk. Sharps can injure staff and must not go into regular trash. Question 91. In a clinical skills review, an assistant is unsure how to handle a chemical disinfectant spill. Which resource should be consulted? Option A. Insurance remittance advice. Option B. Patient intake form. Option C. Safety data sheet. Option D. Appointment reminder template. The correct answer is option C. Safety data sheet. The safety data sheet gives hazard, handling, storage, and spill response information for chemicals. Remittance advice explains payment decisions, not chemical hazards. An intake form does not provide chemical safety instructions. Reminder templates do not address workplace chemical safety. Question 92. At the start of care in an administrative check-in area, the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A. Lung gas exchange. Option B. Ventricular filling with blood only. Option C. Atrial repolarization only as the visible main event. Option D. Ventricular depolarization. The correct answer is option D. Ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Gas exchange occurs in the alveoli, not on the QRS waveform. Mechanical filling is not the primary electrical event represented by QRS. Atrial repolarization is usually hidden within the QRS complex. Question 93. In a quality control review, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Diagnose the rhythm for the patient. Option B. Discard the tracing to avoid alarming the patient. Option C. Change the tracing to make it look normal. Option D. Give the tracing to the provider promptly according to protocol. The correct answer is option D. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Medical assistants should not provide a cardiac diagnosis. Abnormal results must not be hidden or discarded. Altering medical records is unethical and unsafe. Question 94. At the start of care in a diagnostic testing area, a patient becomes angry about a long wait time. Which response is most appropriate? Option A. Ignore the patient until the appointment starts. Option B. Acknowledge the frustration and provide a realistic update. Option C. Blame the provider in front of the patient. Option D. Tell the patient to calm down or leave. The correct answer is option B. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Commands can escalate conflict and harm patient rapport. Question 95. At the start of care in an infection control audit, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A. Perform blind finger sweeps immediately. Option B. Give the patient food to push it down. Option C. Leave the patient alone until they stop coughing. Option D. Encourage coughing and monitor closely. The correct answer is option D. Encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Blind finger sweeps can push the object deeper and are not appropriate. Food can worsen the obstruction. The patient should be monitored because the obstruction may worsen. Question 96. After reviewing the situation in a walk-in clinic, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A. Handle the dressing with bare hands. Option B. Use gloves and dispose of the dressing according to biohazard policy. Option C. Place the dressing on the clean supply tray. Option D. Save the dressing in the patient's purse. The correct answer is option B. Use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Bare hand contact increases exposure risk. Soiled material can contaminate clean supplies. Biohazard waste should not be sent home in personal belongings. Question 97. During an outpatient laboratory, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A. Tell the patient the practice is foolish. Option B. Ask respectful questions and avoid judgment. Option C. Assume all people from that culture act the same. Option D. Refuse to document relevant information. The correct answer is option B. Ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Judgmental language damages trust and may prevent disclosure. Stereotyping ignores individual differences. Relevant patient information should be documented according to policy. Question 98. After reviewing the situation in a quality control review, the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A. Produce bile. Option B. Filter lymph. Option C. Transport oxygen. Option D. Create antibodies as their main role. The correct answer is option C. Transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Bile is produced by the liver and stored in the gallbladder. Lymph nodes filter lymph rather than red blood cells producing this function. Antibody production is associated with certain white blood cells and plasma cells. Question 99. Before the visit continues in a quality control review, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Demand payment details with full medical history. Option B. Leave limited information and a callback number. Option C. Describe the diagnosis in detail on the message. Option D. Leave another patient's results for comparison. The correct answer is option B. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Excessive information violates privacy and may not be necessary. Detailed clinical information may be heard by unauthorized people. Sharing another patient's information is a privacy breach. Question 100. While working in a treatment room, the term dysuria is documented in the chief complaint. Which symptom does it describe? Option A. Painful or difficult urination. Option B. Ear inflammation. Option C. Excessive thirst. Option D. Difficulty swallowing. The correct answer is option A. Painful or difficult urination. Dysuria refers to pain or difficulty with urination. Ear inflammation is otitis. Excessive thirst is polydipsia. Difficulty swallowing is dysphagia.